who already have shown up live. I know other people trickle in as the time goes on. The three of us have a very specific topic that we want to address, and we are talking about ways that we can help clients. We're going to use the word detach, at least at the beginning, detach from the very specific content, topics, themes that they tend to work on and worry about. And we want to help kind of elevate the conversation of treatment up to a level where we're actually addressing the disorder instead of getting mired in the weeds of people's content and topics. So we are going to get to that in just a few minutes. I want to say a couple things about what we all know is going on. One is we're supposed to be vulnerable right now. We are supposed to be afraid. Fear right now is directing our actions. It's leading us down a path that we should be going down. If you walk into the grocery store and you feel like your mask is on too tight and it's hard to breathe, you leave the mask on anyway because your fear tells you that's more important to do. So there's nothing we're going to talk about tonight regarding turn your fear off. What we want to be talking about for a while is how do we modify that level of fear? There are legitimate worries right now, and what happens with the anxiety disorders and OCD is it takes over that territory, and we end up thinking, because this is such a legitimate fear for us to be having, that therefore it's expected that we be worrying throughout the day and feeling that kind of distress. And so we want to really separate out that whole theme and help people understand the difference between legitimate concerns and worries and what I might call disordered thinking and disordered actions. So, left to its own, our worry is going to think that it is problem solving, and it is not problem solving. It is problem generating. So in a moment, I'm going to let our other two panelists introduce themselves, and the specific focus we're going to start on and hopefully carry through our hour and a half is how do we redirect our clients' attention and help them understand that there are actually some unconscious processes that are at play that are influencing their reaction. So, but first, our two esteemed panelists, Marisa, you want to introduce yourself for a moment?
Sure, I'd be happy to. Thank you. My name is Marisa Mazza. I'm a psychologist located here in San Francisco, also providing telehealth right now to be able to support folks. And my team and I, we specialize in doing things like ACT, acceptance and commitment therapy, as well as exposure and response prevention to be able to help teens and adults deal with different uncertainty, OCD uncertainty, general anxiety uncertainty, and sorts of all the uncertainty that we're facing right now. And Reid, I kind of heard what you said, and the other thing I want to throw in there is the great sense of loss that so many people are feeling right now, just in terms of how much COVID is impacting our lives, right? In terms of a sense of loss of finances for some, loss of health and lives for others. And there's a great deal of uncertainty we're facing right now because we don't know for how long and how when this will all be over, right?
Yeah, it'll be great for us to get back and dig down into that specific topic as well. Jon, you want to introduce yourself?
Yeah. Hi, everyone. I'm Jon Hershfield. I'm director of the OCD and Anxiety Center of Greater Baltimore in Hunt Valley, Maryland. And I also specialize in treating OCD. I would say we do somewhat traditional CBT and ERP, and we're also mindfulness enthusiasts. So I guess sometimes I get told that I've been doing ACT, but I didn't know it. And Reid, I really liked your use of the term attention to kind of describe what we're trying to help people utilize, and sort of tying in also what you were saying, Marisa, that right now our attention seems to be grabbed by this big thing and it seems to be going in these different directions. And a big part of what we're doing when we're helping people with OCD is teaching them how to use their attention more skillfully, what it is they could be focusing on when they're feeling like they have to be focusing on something else. So I'm looking forward to discussing that today.
Okay, great. And my name is Reid Wilson. I'm a licensed psychologist in Chapel Hill, North Carolina, specialize in the anxiety disorders and OCD. So I see lots of folks individually. I do some intensive 2-day treatment groups, including 2 that I do at the conference each year for the OCD Foundation. I'm actually doing more self-help coaching online than I ever used to before. So that's us. I think we have 3 big categories that we're going to cover for a little bit. And just reminding you, you can pose questions to us. And when we get done doing our passing on some information to you, then we can take some questions that you might have. I think the first category that we might talk about, and maybe Marisa, you can begin. What do we want to be conveying to our clients? What do we want them to be holding on to when they finish treatment? What are the understandings that we'd like them to have? What are the kind of posture we want them to be taking around the obsessions and compulsions and the extreme worries? Can you talk a little broadly around that idea, especially around detachment and kind of stepping back and taking a different perspective on these problems?
Sure. I mean, when folks first come to see me, I think the main thing that I want to focus on is that, like, this isn't just about treatment. This is very much about their life and how they're living. And so oftentimes what we'll do is spend a bit of time taking a look at what has been going on so far. Has sort of the different control strategies, have the avoidance strategies been helpful in does it get them closer to the life that they want to live and the things that they actively want to be doing? And by the end of treatment, my hope is that folks have an idea of how to embrace uncertainty and be able to really know that no matter what the mind is saying, they have a choice in how they can respond to it.
Yeah. Okay. Good. And I like the whole idea. I think what you were saying is, what have they already figured out that works for them, as well as some of the patterns that aren't so helpful, and so that we can kind of build on that with them. Jon, what would you say around this set of questions? Yeah,
I mean, I think that the tendency is to think that people with OCD and anxiety are having irrational thoughts, but I don't think this is true. I think they're having perfectly rational thoughts, at least most of the time, that they're just responding to in a maladaptive way. I mean, nobody wants to be sick. Nobody wants to wake up and realize that their identity is not what they thought it was, and things like that. So these are reasonable things to be resistant to, but the strategies for dealing with that resistance seem to have gone haywire. So the behaviors have become irrational, but it's not the thought's fault. The thought's a free agent. It has no opinion about the person who's doing the thinking. It just sort of arises in consciousness. So tying in sort of what I was discussing before about attention, the purpose of therapy, in my opinion, regardless of what therapy is for, is to reduce suffering. And we know very little for certain. We know that we're conscious, and we know that there's this thing called attention. And we know that if we use our attention in different ways, it can create more suffering or it can reduce suffering. And so the goal is to suffer less than the most you could possibly suffer. And that's what I want clients thinking about when they're doing treatment. It's not about being free of unwanted thoughts and feelings. It's not about feeling good all the time. There's certainly nothing wrong with habituating and feeling less of that intensity, but mostly what I'm interested in is helping people to get better at having these thoughts and feelings.
Okay, great. And I guess if I were, I'm have my own little kind of way I work with folks that may be a little different than other folks, but I think we'd all agree, at least one of the things I want to present to them is how to step back, and how to step back, not only step back in perspective around what's going on with the disorder and how is it running me? What's it doing to manipulate me? But also, and so that's, you know, critically important at the very beginning. And I think in the moment of the distress, in the moment of that urge to do my compulsion, or to worry excessively, or have my obsession, is I also want to step back in that moment and have some kind of response, like, oh, I'm doing it. We'll talk more about some of those very specific ways that we would then respond. Where I want them to get to when everything is done and they're on their way is, in essence, when the obsession, which is repetitious, unproductive thoughts, feelings, and impulses that scare the bejesus out of us, when the obsession pops up and I hear that kind of message, is to just, in essence, go, none of my business. Even if they just have a kind of mental waving of their hand to get rid of that, I don't want people in those moments to do a lot of talking in their head about that moment. I don't want them to have to be talking about and rationalizing why it's not necessary to dismiss this thought. I want that to be figured out in the session with me. I want us working in the strategy while they're not in the middle of the problem, and then kind of lock down that strategy. And when they get into those moments, I want them to be like a worker bee. Just, I may not like what I'm supposed to be doing right now, but I'm going to follow the agreement. And that if we don't lock that down, what I've found over the decades is that the intrusive thought starts to go, well, just question it, right? I think this is a different moment. I'm not sure that fits right now, and everything starts to crumble. So I really want them to get hard and fast around some of those agreements. I also want them to know, and it's especially important early on, that we know what the outcome picture is. We're all working together to quiet some of this kind of stuff, but I don't want them paying attention to, I have to get rid of this disorder. I have to get rid of these feelings. Whatever, people will come back in and see us, and they'll say, well, it's not working. Well, what's not working? Well, I tried that, and the obsession came back. Well, that doesn't mean it's not working. It's you don't want to be judging it like that. And so in the moment of the experience, it's going to seem a little different than the outcome picture that we want. That I am not trying to get rid of symptoms. I am trying to respond to them differently. I am not, and it's a little like what you were saying, Jon, I'm not in control of what pops up in my mind. That's unconsciously mediated. What I don't have control over that. Just like we don't have control over the pandemic right now. What I'm in control of in that moment of obsession is what I do next. What that moment of that urge to do the ritual, what I do next. I'm in control of how I respond to all these terrible turmoils around the world, around the pandemic. That's three things. I got a fourth thing that I do talk about with everyone, and is this concept around signals versus noise. That signals are worries that are telling me I need to solve a problem, and it's time to solve that now. And so we're supposed to problem solve. And, that's the worry grabs us and gets us to start to think about that. And then noise is really what we would think the obsessions are, unnecessary. And so if people don't sort out what signals and noise are, they can get really lost for a while. The clever manipulation of the disorder is that in those moments, it starts going, are you sure? So it introduces uncertainty even to the strategies. And one of the things that I would maybe want people to have is, if I'm feeling unsure about what I should be doing right now, and whether or not even this is OCD, I'm confused about that, I'm going to err on the side that this is an obsession. and I'm going to operate like that. Because if I don't do that, then every event is going to be an exception to the rule. And so the last thing I would say here, since I'm just like talking, is I have a concept that I talk about, act as though, and really mean operate as though. So I'm going to figure out what is that obsessive content and how would I operate if that message was nothing. And even though I may be feeling a lot of distress and uncertainty as I move on, I want to be taking the actions as though the obsession is nothing. So,
Reid, I'd like to pick up on that actually, because I think people underestimate how strategic that is. I mean, you were talking about you don't want somebody to explain to themselves why it's OCD and therefore it's okay to move on. You want them to just move on. It's the junk, right?
Yeah.
And I think people often understand that to just mean, okay, so I'm supposed to try to ignore my thoughts. But what they don't really understand is that that's sending a very specific signal to the brain for how to interpret the significance of those thoughts. When you're engaging in mental review, you're telling the brain, there's something to find out here that we haven't found out. This is an open case and we need to solve it. When you're engaging in the behavior of a person who's already resolved it and is now moving on to the next thing, even if you're anxious, even if you're feeling, like you don't have confidence in it, the brain is still watching you engage in that behavior and forming a conclusion about it. I often tell my clients, your brain is a machine. It doesn't have an opinion about all this. So it doesn't know that you have OCD. When you're avoiding something, it's not thinking, oh, your OCD is making you avoid it. Your brain is basically processing, oh, that's dangerous. Everything you do must be rational to the brain. Or he avoided that, it must be dangerous. Oh, he engaged with it, it must not be dangerous. That's a big part of why exposure therapy works, because it encourages people to behave as though they've resolved the issue, even if that's not what they're feeling. Your brain doesn't really have an interest in that. It's just like, oh, this person was scared and they touched the scary thing, therefore the thing can't be that scary. Okay. Duly noted. Next time they engage with that target, whatever their content is, it comes tagged with that additional information. This is uncomfortable, but it's not a big deal. We know because the behavior has showed us.
Yeah. Just kidding. It's fine that this is happening. So Jon, do you feel like that ultimately is what we're doing, is training the neurology, laying down another neural pathway around this? Is that ultimately what we're doing when we do these kinds of interventions?
I think so. I think it's a kind of learning. The brain has learned that it's supposed to encourage you to respond compulsively because you've been responding compulsively. And now we're teaching the brain that there's another response. And then that's forcing the brain to recalculate the significance of the object of attention, whether it's a thought, a feeling, or a sensation.
I just mentioned that Stephanie Woodard has written you a note here, Jon, saying, sounds pretty acty to me, Jon.
I'm going to make it my mission in life never to get any act training and see how far I can go.
I don't know about that. I don't know about that. I mean, the one thing that I would maybe add to like what you're all saying is I completely agree in terms of shifting our focus and attention to, we don't know. But then also adding in this piece around the values. What do we know? We know what's important to the person. We know what really matters to them. And I would so much rather see the folks that I'm working with spend time living and doing the things that really matter to them and less on sort of what's happening in here.
Yeah, and so if I'm motivated for that outcome picture, which is my values, what do I need to do to line myself up to reach those values? Is that what you're implying?
Yes, and how could I be spending my time, right? Like what's the cost of all that problem solving, right? What's the cost of engaging? That's time, right? That's time we could be spending on other things that really matter to us.
Right, and that's what I love about that, which is I'm redirecting my attention instead of going, oh, there's this disorder, I've got to fight it, I have to get rid of this, I have to stop that. What Jon was saying too is, where do I want to bring my attention?
Right.
Um,
Right.
and, part of what is going to typically happen is I'm going to turn my attention elsewhere, and I'm going to be somewhat distracted because there's a part of me that's still kind of going, where are you going? You need to pay attention to this. And so I don't have all my wits about me, perhaps when I start leaving home and driving to work, or when I'm trying to concentrate on a task at work. And nonetheless, I'm doing it. Right. So
Right.
I think that highlights one area of importance in ERP, which is people with OCD, when they come into treatment, they're used to being on the defensive. The offending thought, feeling, or sensation shows up, and then they're like, what do I do? How do I deal with it? And they're just scrambling to protect themselves from this scary concept. And in ERP, what we're really doing is we're giving people reasons to do compulsions so that they can practice getting in that space where they want to compulse and then don't compulse, right? Then they choose not to do that. They do something else. So that space between being triggered and then responding to it with a compulsion becomes another object of attention. It's a thing they can experience, whether we're calling it uncertainty or anxiety or distress or disgust. The purpose of exposure is to get that practice of going on the offense, not just being on the defense and saying, look, let me push, get a push notification on my phone reminding me about this terrible, scary thing. And now I'm with this feeling, and I really want to analyze it, and I want to get reassurance about it, and I want to make it go away. And instead, I'm going to go do something that I value, like Marisa was saying.
Mm-hmm.
And then that's where the learning takes place. I can have the experience of wanting to compulse. That wanting is not the deal breaker.
Mm-hmm. I can bring it along with me and still do what matters.
Yeah, and the exposure is just the practice of that, the development of that muscle.
Yeah, and I do just a slight different variation on what you just described, which is that I, by the end of each session, I want to be having a conversation with them around what can you practice this week that will bring you to some degree of uncertainty and distress about your theme. But very often, if possible, I want them to do a practice in which they enter a circumstance within which they're most likely to have a spontaneous obsession, as opposed to asking them to start thinking very explicitly about what their worry is. It's just a kind of a different way to do it. So,
no, I like that strategy as well. Put them in an environment where they're likely to be triggered.
And if they don't get triggered, in part, it's like, okay, well, that's great. Apparently, I can check that off my list, and I got to go up a notch because this is an aggressive sport. I'm looking to get provoked. I think we would all agree to that. It's like I'm looking for it, and so to some degree, when it shows up, I can go, okay, great, there it is. And the interesting thing about the ridiculous response of great, there it is again, we go back to this neurology. Now I'm laying down a neurological pathway that is next to my fearful response and saying, no, really, I want this. And then, well, first off, I want this because I have to have these experiences in order to modify them. If I don't have them, then they go underground, then they smack me later on and catch me off guard. So I actually want to go get them. And when I go get them on purpose, I'm a little more prepared for what to do then. So that's kind of helpful too. So, and we know the expressions, neurons that fire together, wire together, and that's what we want, I think, in the long run. I wonder if we can go to, we had another theme we were going to talk about, and it's not an area that I do a lot with, and I'm wondering if the two of you do you have particular structures that you like to introduce in treatment that help people catch on to some of these skills? Do you have structured practices that you might suggest that they do to help them get oriented, or do you feel like you just kind of jump right into let's go find an exposure to practice? Jon, do you want to take a shot at this around assignments?
Yeah, sure. I'm not a huge fan in general of what we might call manualized treatment, because I think regardless of what you're treating or what your modality is, therapy is still about the relationship. It's about the relationship you form with this person and whether or not there's trust there. I mean, we're asking people to do things that are terrifying to them. And if we don't establish the right kind of relationship, then they might as well just use a book or something like that and wing it. But all that being said, I have a certain pattern that I follow if it feels appropriate for the client. It usually starts with a lot of psychoeducation. And the first assignment that I give is just what I call a trigger and response log. I tell them in the first session I don't want them to try real hard to get better, because I want them to do a reconnaissance mission and tell me what's really going on out there, and then come back at the next session and we can really get to work. So just 2 columns. One column is what set me off, and the other column is what did I do? And I say, don't try to be cool here. Don't try to resist your compulsions or anything. Just tell me exactly, did you ignore it? Did you seek reassurance? Did you spend an hour ruminating over it? And then we're going to look at that together, and we're going to pick out the patterns, and that's going to be our in for the exposure. We're going to say like, aha, so here's a situation where it seems like it keeps coming up here and you keep responding in this way. Maybe that's a place to start. And so I build what's a sort of a soft hierarchy, which is I'm starting where they're willing to start, and then I'm building it from there.
Yeah, but you're also getting them to step back, right? Because if they're logging it in, writing it down, they're getting that. They may not get it in the moment, but at least later they begin to develop that skill.
And that's the first way I start to introduce the concept of mindfulness, which is I want you to look at what's happening, not just experience it. So the trigger response log is a big part of that. Is the first thing is I want you to notice this is what's happening. This is what I'm thinking. This is how I'm behaving. And then that naturally evolves for a brief period of time into a version of an automatic thought record, where now I want you to notice what's happening and what you're doing, and and I want you to notice the fact that you're thinking before you're doing your compulsions, and that there's a way that you're thinking that maybe isn't helpful, right? And there might be a more objective way of thinking. Again, without getting into rationalization territory, simply being able to say something like, well, it looks like I'm predicting a negative future I can't cope with, but I can't predict the future. So, and this is typical of the way that I think. So, maybe the question now becomes, am I willing to confront the uncertainty of I don't know what's going to happen, as opposed to, oh my goodness, this terrible thing's going to happen and I have to get away from it. Mm-hmm. And then I kind of gently let the automatic thought record kind of fall away into the distance, because at some point it really becomes pointless to have to write this stuff down, because they're out doing all the exposure therapy and they have these words like catastrophizing and magnifying bouncing around their head, and they're becoming more adept at noticing, I'm a person who's having these thoughts. I'm having a thought that I'm noticing a feeling that's described this way in my body. And in the exposure, we're wanting to create that state. What does it feel like to want to do compulsions? Where do you feel it? Is it mostly in your chest? Is it in your throat and your shoulders? And how can we, as you were kind of alluding to, Reid, how can we go after it to generate that feeling, to want that feeling, to send the signal to the brain that this is in the list of things we are allowed to feel. It's not a deal breaker that means we have to do compulsions, even at the sacrifice of our values.
Okay, great. And you talked at the beginning about relationship and with you as a therapist. And of course, it's like, you're going to trust because we as therapists are really just representing a field, an approach. But of course, we got to have rapport with them and so forth. What do you say about the relationship they have with the disorder? What do you have a way you conceptualize that when you're talking to them, Jon?
I think it depends on the person. I think some people respond really well to externalizing or anthropomorphizing the disorder. My OCD is telling me this, my OCD is telling me that. I think a lot of people really benefit from that, but I don't think everybody does. I think some people actually find it more fruitful to just, forget about using the word OCD at all. This is not an OCD thought, as opposed to some regular thought that I'm supposed to accept. It's just a thought. And what are thoughts? They're words that are scribbled on the walls of the mind, right? So if I see the word cat on a piece of paper, or I see the word pedophile on a piece of paper, those are still two pieces of paper that have ink on them. They're not fundamentally different pieces of paper. So calling one thought an OCD thought and then treating it in an OCD way while you're calling another thought perfectly acceptable and you're dealing with it in some other way, kind of defeats the end game here, which is to view all thoughts as thoughts and then choose your behaviors based on what you think is the best use of your attention.
We had a question that came in around 621 from Lucky Spa, and I think it stemmed out of what you were saying, Jon. So maybe you can take the first bite of this. And they're asking, what's the difference between shifting attention to some other place? And I think Marisa's kind of alluded to that as well, and using distraction as a way to avoid. One sounds like it's a negative thing to be doing, using distraction. I assume that's what they're judging that about, and shifting attention. Either of you want to respond to that?
Go ahead, Marisa.
Yeah, sure. I'd be happy to. I think one of the things that I'm sort of coaching through with my clients during exposures is whatever they're doing, I want to know, is it helping them connect in the moment to what the experience is? And so whatever helps you connect, whatever helps you feel in your body, right? Every emotion is linked to a physical sensation in our bodies, right? And so as Jon was saying earlier, where is that emotion showing up? And is what you're doing going to help you get there? And for some people, maybe what we use the term distraction may actually help them connect. For example, some people may imagine, it's a fist in my gut and it just feels really, really tight. And using that imagery might actually help them to connect. Now, there are other times where perhaps a distraction may take them away from that experience. The way I see it, the whole point of doing exposures is to help them get better at feeling uncomfortable, right? Get better at feeling the sensations, get better at embracing this idea that we don't know what's going to happen, right? Can I not know what's going to happen, have these uncomfortable feelings while still doing and acting in a way that's according to my values and what's important to me? And so if distraction helps them get to that place, then great, I'm all for it. But if it doesn't, then maybe that's when they want to choose another behavior.
And I would say similarly, like one way of thinking about the difference between attention shifting and distraction, if we are looking at one as being better than the other, attention shifting is about going towards something of value or returning to something of value from which you became distracted. So if you're meditating and you're watching your breath and then you start ruminating about what's going on in the world, and then you realize, okay, that's thinking. And then you return your attention to the breath. I wouldn't say you're distracting yourself away from the scary thought. You're basically just acknowledging that your attention was placed in one place, and then it wandered to another place, because that's what attentions do. And you happen to notice it. And so you brought it back to that first place or towards some other place. Whereas distraction is really more about running from something. I can't think this. I got to get away from this thought. I have to boggle my mind with something. Where it gets really kind of confusing for people, understandably, is that sometimes we do use distraction strategically to interrupt mental rituals. So someone is problem solving and they're thinking and they're never going to get there because they're doing a ritual. And sometimes the best way to get them to detach from that mental ritual is to throw in some kind of distraction, kind of boggle the mind kind of thought, like, think about the sound of a 56K modem, turning on, and then redirect your attention. Some people need that extra push that comes from distraction, I think.
Yeah, just like I might, I've told people a number of times, just like if they're at the computer and they're getting hit, just get up and move away for a bit in order to see if you can refocus your attention. And I think how I couch distraction as, this is bad. This is scaring me. I got to get away from this, and I got to block this, and right. And the term I tend to use in alternative to that is refocusing my attention, which has a little more to do with strategically shifting my attention away. So
there's a comment there, the Lucky's Paw. It says, but distraction is I'm going to count ceiling tiles rather than have the thought about molesting my kid. I think that pretty much sums it up. And I would say attention shifting would be, okay, I'm having these thoughts, and they're going to be there or not be there. I'm not going to figure it out. But in the meantime, I think I'll get back to this project I was involved in. Maybe they like counting ceiling tiles, and it's not compulsive. They could do it out of choice if they want, but not as a strategy to run from a thought.
Yeah.
And I think what everybody is sort of pointing to is like, what is the function of the behavior, right? Like, what's the purpose of it? How is it serving me? Is it serving me as a way to sort of escape these experiences, or is it serving me in a way to learn how to have them and be able to do what I want to do?
So, Marisa, you want to take a shot at that second level of questions? Do you introduce particular structures with folks? Do you have some stepwise things you have them do before you begin to just launch them into doing exposure and response prevention, or whatever you might do in your treatment?
Yes, I say I have like a flexible structure, right?
You're not manualized.
Right.
Okay.
Before I like to set the stage for exposures. I probably spend a bit more time in the beginning on setting the agenda for therapy. So one of the things I do is kind of incorporate what we call like a creative hopelessness exercise, and really sort of take a look at, how long has this problem been here? And when I say this problem, some people label it as OCD, some people label it as perfectionism, some people label it as control, right? But we sort of take a look at like, how long has it been here, and what are all of the different ways that you've tried to solve this problem, escape this problem, cope with this problem, and has it worked? And oftentimes what we find is that it does work. And this is why people do avoidance, right? Because it works in the short term, right? In the short term, it sort of gives that escape. The problem is, and what most people will notice, is that it doesn't necessarily help in the long term in terms of making those experiences go away for good. They continue to be there. And the majority of the time is then spent on the problem rather than on living and what truly matters to them. And so I sort of really focus on trying to set the stage that I don't want what we're going to do to be another one of those tools. I want what we're going to do sort of be a bit different, right? To really learn how to have the experience, because it's, as of right now, it's here, right? And we've tried all of these different things. And so far, what we do know is it's getting in the way of how you're living. And so I sort of set the agenda in that way. And I identify, and oftentimes folks will say they feel hopeless in that moment. And the message I send is that it's not hopeless. The agenda of trying to control and get rid of is hopeless. And when I say get rid of, I'm specifically referring to the obsessions and the feelings, right? Like, but yeah. My hope, and I have hope for, and the agenda I propose is a new pathway. It's a pathway of really learning how to have these sensations and experiences, and being able to get on that plane and see your grandson, or, be able to spend more time with your family rather than curled up in a ball in bed. Mm-hmm. Right. And so I definitely spend time doing exercises like that. I spend time doing exercises, getting really clear about what their values are. And then I also, similarly to Jon, will do an OCD log. And the one thing I really love, I use Alec Pollard's model of trying to get to some of the core fears around that. And I'll ask the clients to really notice, like, what are some of the commonalities among their obsessions? And it's a way for them to recognize that, oh yeah, this really isn't about this specific obsession. Like, these are all related to uncertainty. Right. Right. Really, what's at the root of this is uncertainty. And then they look at, like, what are all the commonalities between my compulsions and all these other behaviors? And oh yeah, so when uncertainty shows up, this is my typical response, right? And then using sort of some of Alec's model is, and what does my mind say about me when uncertainty comes up? Does it say I won't be able to handle not knowing, or I won't be able to handle the feeling? And what I say is, let's see. right? Let's actually start doing these things that are so important to you and let's see if you can't handle it.
That's great. I love that part.
Yeah, I think I told somebody once, I'm going to try as hard as I can to turn you into a serial killer, but I've never been successful. So yeah, let's.
But I have hope.
But I have hope. Exactly. I think it's also really important to have the client believe in what they're doing and have them believe that it's actually their idea that they're doing it. That, you know, I'm sort of providing them with a roadmap, but it's their travel. So I'll take out a dry erase board and I'll draw the obsessive compulsive cycle and I'll explain negative reinforcement. And I'll say, so, you know, looking at this, how do you treat OCD? And I just have them explain it to me. And if, you know, 9 times out of 10, we're already on the same page. And it's like, hey, that's a great idea. I think we should do that. Let's identify and eliminate your compulsions. Well thought of idea.
Yeah, that's great. And so, yeah, and I think all three of us would say we're building a collaborative relationship with them. I do play one up at times in terms of presenting something as an expert or whatever, but I also play one down. You know, first off, I don't know you, and I'm a cognitive therapist, so we're going to do behavioral experiments. We may come up with some ideas, or I may introduce a strategy, but instead of, you know, any hard and fast guidelines of what you're going to do from now till the end, let's go check that out and learn. You know, let's see what we can learn from doing that experiment, and then we'll come back in and we'll tweak it as need be. So, and follow up on something Marisa was saying is the other thing that I assume we do is we go, you know, if you see somebody who's had OCD for 40 years, has it always been the same theme? You know, what has changed over the decades or the years since you were in 3rd grade, and what has been consistent, or what has been the same? Let's look at what is the same. And then we start getting the pattern of the disorder and help them starting to get off of the topic. A lot of what you were saying, Marisa. I wanted to ask a follow-up question to you, though. You were talking about getting kind of like old school, we would say values clarification. Do you lead with that? Do you try to get that tied down prior to getting into any of the behavioral work with people? You feel like that's just get your values set and lead from your values?
My like when I think of my treatment plan for my clients, yes, do I want to reduce compulsions? Absolutely. And overall distress, right? Like, absolutely. But the other thing that I'm really focusing on is what are their values-based behaviors? Those are actually my behavioral goals for therapy, and they come directly from their values. And it seems like, I feel like this term values gets thrown around a lot. And it's really interesting, like when I actually sit there and we do some exercises around this, like it's easy to say sometimes what the values are, but when we really slow down and pause and try to define them and sort of take a look at what does that mean in my life, it's hard. It's really hard to do. And so I think it's worth spending the time on that, because ultimately I think that's what's going to help them later on to do those harder exposures.
I think a lot of people, oh, sorry, Reid.
I was going to say, when I do these intensive groups, have 8 people, and I actually start the group off with having them just throw out, and I'll write up on the whiteboard all the things that they feel like they have missed out on by having the disorder. And you know, the litany of lists are pretty standard. You know, education, family, love relationships, work, promotions, and so forth. And once we get, you know, a good 15 or 20 of them up there, I said, can we transform this list? What would you think about this? Let's go from what you feel like you've missed out on to where you would like to go in your future. Would that still hold up? And for most people, it does. And it's a very simple way in that group setting to kind of get that objective set. I and I go back to that list over and over again in the 2 days, which is, we're not getting rid of this disorder. We're going toward that. And what does it take for us to get to there? So, Jon?
Yeah, I just want to make a comment about when I talk to people about their values, what I often find is that it's very wrapped up in a story they have about their identity. I am a this kind of person. I am a that kind of person. This is the kind of husband I am. This is the kind of professional I am. I value being that kind of person. And you meet a lot of people who have kind of done the world tour with their OCD. They've had every obsession under the sun, since third grade, and they think of themselves as having a lot of obsessions. But if you ask the right questions, you realize that all of these obsessions come down to a fear of identity annihilation. If this fear comes true, I won't be that person. I will be a person who committed a violent act, or I'll be a person who engaged in a sexual act that doesn't connect with my identity, or whatever it is. And that's why I'm always asking people when my clients come in and say, I have a new obsession, and I say, stop right there. And I want to know, how is it like the other obsession before you even tell me what it is? Well, if it comes true, and it means I'm a bad person. If I'm a bad person, I'm not going to be this kind of person. So, when people become overly attached to, I have this kind of OCD or that kind of OCD, they tend to get really hopeless because they think of fighting OCD as this whack-a-mole project where they knock one down and another one comes up, and they knock one down and another one comes up, and it's just endless. Now, you can get better at whack-a-mole. If you play it long enough, you start to kind of intuit how quickly you can do it, but it's still exhausting, and it's like no way to live. When you're able to step away from the game and realize this is not whack-a-mole, this is just one thing that arises, and it's something I'm familiar with, and I know how to handle it. Well, now you have some real mastery over your OCD.
Yeah, really nice. Yeah. So in this broad question we were talking about of structures, as I said, I don't do a lot of that, but what I think of as we're talking about this is one thing I do rest on is rules. So if we think about right now in the pandemic, what do I do and how do I control and how often and so forth, is that we just walk it through. What do you think is a reasonable way to respond to having groceries brought into the house, and what is the procedure you would like to take about that? And if you're going to go to the grocery store, how is it that you feel like would be an appropriate way to enter the store and deal with people around you and so forth? And so if we can, for me, if we can, in some of those tasks, if they can decide, okay, well, look, after I've, cooking, cut up raw chicken on the cutting board, this is how I'm going to wash the cutting board and how long I'm going to take and what detergent I'm going to use. And here's what I'm going to do around washing my hands. And I'm going to sing happy birthday twice. And I'm not going to sing, and you smell like one too as part of the song, but that's what I'm going to do. And so once we can kind of lock that down, then they can operate out of those lean on those rules somewhat when they're trying to figure out in that moment. They just go, okay, well, I've decided, and that's what I'm going to follow about that. So
how do you approach someone who's trying to follow the rules that have been established in your work with them, but then they break the rule because they had a thought that they thought was a game changer? Like, this time I can't just wash my hands the way I had decided. What do you tell them when they come to you with that? I'm curious about your approach.
Well, we'll just let's go through it again and let's see. Now we're sitting here and you're not in the middle of that moment. Do you feel like it was important in that moment to break that rule and to go off on your own and do something in excess or avoid something? And then, again, I'm going to be somewhat laissez-faire around what those rules are, because this is their work, as we've been talking about. But if I have some other thoughts about it, I would, and that, I think that would be the distinction I would make around how are you feeling now about the decision then to have changed that rule, and would you like to have stayed true to your commitment from the last session, or do we have to renegotiate what the rule is? I mean, these rules are not they're never my rules. They're their rules. And so that's how I would typically respond to it. What, you have any thoughts about how you would do that, Jon, or you don't do rules? So
well, I just find it a consistently challenging place for with some clients where the rules have been established and they're working, and then the presence of an individual thought basically says, well, you know, if Jon had seen me in this moment and understood this thought, he wouldn't have thought that the rule applied now. It applied for all those other things, but not now. This is different. It's a different kind of chicken on the cutting board. You know, everything is different. So, I mean, I have different ways of addressing that. I think a lot of it really just depends on my relationship with that person. With some people, I might say, you know, them's the rules. You don't get to break them. If you want to break them, you know, we can talk about it next session, but follow them even if it seems crazy. And with others, it might be more of a negotiation of like, well, you know, that's true. You do need to be flexible. And, you know, if you're inflexible with any rule and it can't be bent, well, then it breaks and everything falls apart. So sometimes you need to, you know, allow for a little bit of compulsivity, especially in this time where people are trying to follow the CDC rules, but there's also extrapolations from those rules. Well, does that also mean I'm supposed to be washing this, even though it doesn't actually say that on the CDC website? And navigating that territory is difficult for all of us, not just for people with OCD.
Yeah, and I think, you know, since I do personify the disorder, I would like them as close as possible to the moment where they broke that agreement to be able to say something like, okay, you got me on that one, next one's mine. And so they recommit themselves to a guideline. Marisa, were you going to say something there?
Yeah, I was going to say a lot of, you know, what I've been getting recently, especially with the CDC guidelines and everything coming out, is this OCD or is this what I'm supposed to be doing? Like what you know, I've noticed like my washing compulsions have increased, and I'm wondering, like, is that OCD, or am I just doing what I'm supposed to be doing right now? And is this an OCD thought right now, or is this a thought that's actually sort of helpful? And so it's confusing. It's confusing for us. It's confusing for everyone. And I think, you know, the place that I go to is, you know, what's going to be helpful right now, like what's important to you. And most people do have something important about taking care of themselves and other people and the families around them, right? So that usually falls within the lines of following CDC guidelines, right? But then noticing what are the other fears that are associated with that, if at all. And you know, whether it's an OCD fear or a fear related to our reality right now, how do you want to relate to that? And is that going to help in the long term?
Yeah, and I think what is buried, I mean, what is in part of what you're talking about is underneath some of that questioning in the session to you is a form of reassurance. I don't know whether it's this or that. What do you think? And then I think it sounds like you kind of toss that back to them. It's, well, let's talk about that. What do you think? So
people are putting a lot of pressure on themselves. Where I'm seeing in my clients who are struggling with OCD specifically related to COVID is the point of all this social distancing to them is don't get COVID, right? Don't get caught getting the disorder. If you got the disorder, you lost the game. The disease, you lost the game. And I don't think that's the point. The point of social distancing is it's your civic duty to keep the hospitals from being overwhelmed.
Right.
You may get COVID anyway, right? You could follow all the rules and wash your hands a gazillion times and just, you know, luck of the draw, you know, you missed something or you didn't miss something. It just happened, right? Not everybody who has contracted this virus did something wrong or is bad. So putting all of this pressure on yourself to be certain that you're not going to get it is producing a lot more unnecessary compulsive behavior that doesn't keep you any safer, that goes above and beyond the CDC guidelines to get away from that feeling of discomfort of, I might get it. Well, no, I won't get it because I took an 8-hour shower after reading my mail. CDC doesn't say I have to do that, but now I know I won't get it. And a lot of that pressure is just coming, I think, from a misunderstanding of why we're doing all this. It's not to keep you from getting it. It's to keep you from going out and trying to get it and giving it to everybody else. Any individual, who knows? We just do the best we can, but we can't be perfect and we can't be certain.
No.
And we had a third level, and we've got all these great questions coming in, but I want us to cover this last piece, and then we'll go after some of these questions. And we've been starting to answer this, I think, this whole territory of in the moment, when they have that moment of obsession or that moment of that urge to do a compulsion, do you have a strategy that you coach them through in terms of how to respond in that moment? And I'll take a stab at that to start with. And we're talking about detachment, and we're talking about engagement. And I think unless we can get that detachment of stepping back to happen first, then they're going to have a foot in both camps. And so I do want people to understand I gotta kind of notice that I'm doing it and step back from that moment and then engage in whatever it is that how I want to respond in that moment. I'm not detaching from feelings. I'm detaching from some form of resistance to it all. That's what I want to detach from. And the fight, the getting rid of the this is bad, this is wrong, I don't want this, and so to be able to understand that particular piece, I have an argument with a friend who is totally wrong, that he is talking about detachment being kind of putting those feelings to rest and stepping away from the emotions. And I just, no. So I want to step away from those kind of disordered beliefs and my resistance, I think. And so I do kind of talk about stepping back in order to step up. So I want to step back in the moment to step up to what are the concepts that I'm trying to step into? What is the strategy? What is the disorder trying to do to me? And what is it? How do I want to be responding to that? And so if I don't step back, then I can't get up. And then we want to, for me, it's like, okay, whatever I want to understand what those principles are, and then how do I manifest them in this moment? I don't want to be having to think about that in that moment, but I want to have that already kind of worked out. But that is the task, I think, is to activate the strategies that we've worked out in this particular moment to the best that I can. And as I said before, in the moment, I want to be thinking about this as an aggressive sport. I am going after something. Jon was saying at the very beginning around kind of being victimized or one down from it, and I want to flip that around to the best of my ability. And sometimes I have them literally, if they're going to be a little more cunning, talk back to the disorder. Is that all you got? My heart rate's only at 90 beats a minute. If you can get my heart rate up to 120 beats a minute with scary thoughts, Reid's going to put a gold coin in my safety deposit box. I want that, right? So anything around, I'm going after that. I want this. I'm not going to avoid this anymore. And the other piece would just be, I got this. I can do this. I can handle this. I can cope with this not going well. So those are the kind of things I would start to want to help people focus on in those moments. Either of you want to talk about what you might be doing in those moments with your clients?
I mean, as you were sort of talking, what came up for me was sort of the quicksand metaphor that we often sort of use in ACT, right? If we get caught in quicksand, what's the natural response? Fight it, right? Like, get me the heck out of here. I'm going to do everything I can, right? And what does that do?
It decreases your surface area and sucks you down into the bottom of the pit.
Exactly, right?
Not a good thing, apparently. No, not a good thing. Okay. All right. So I'm going to write that down. I'll write that down. Do not squirm.
So, I mean, what else could we do? Right? We can stay still, right? We can move really, really slow.
Oh, this is a pop quiz, John. So we're
I realized that. I was
I
making, you
see.
can't really see in the screen. I was making myself wider. I wasn't just staying still. I was actually opening up to it even more.
Wider.
I'm hanging here. I'm hanging out. I'm not trying to go anywhere.
I think you have taken a few act trainings, by the way.
It sounds great.
What I want to say is, like, that's our natural response, is to want to fight it, to get away from it. But emotions are different, right? We know that we actually need to do the opposite, which is actually move into them, move slowly, move into them. And so when in those moments of crisis, I think what I notice is some folks detach or diffuse from the thoughts a little bit more easily, or they already kind of are there a little bit more, and other folks aren't. And so one of the things that I try to do, particularly for some of the folks that have a hard time detaching, is sort of teaching some cognitive diffusion. For example, like, I'm noticing the thought that, or my OCD is telling me this, right? Automatically sort of putting a little bit of distance between them and the thought. And and then the next step is, there's an opportunity to lean into uncertainty. I don't know if this is true or not. It might be. Let's see. Right? And then there's the opportunity to then connect with the feeling sort of in their body of, what does that feel like to really not know.
And not knowing is a skill. I think, people with OCD are really good at knowing, right? They're good at collecting information. They're good at researching. They're good at problem solving, and knowing is a skill, but not knowing is also a skill, right?
Yeah.
Your pilot needs to know how to operate the plane, but he also needs to know how to sit with not knowing that something may go wrong with the plane. And if he's incapable of sitting with that not knowing, he's just going to be an anxious mess, and he's going to make a mistake. So the not knowing is just as important, and you can exercise your not knowing skills by sort of, along what you were saying, sort of putting yourself in that state of uncertainty and saying, oh, so this is what it's like to not know. And do I have a willingness to feel that? Reid, you had given us a peek at some of the questions you might ask before this, and so I wrote down some notes, and I wrote, if feeling, what to do if feeling the urge to ritualize, what do I say? And I just wrote, good, with an exclamation point.
Good for you, John.
Good, that's right. I want you to feel the urge to ritualize, and I want you to celebrate that urge to ritualize. People get this idea that they're supposed to watch a scary movie and be bored. And that is missing the point of life. You're supposed to be scared when a scary thing happens. Right. And then the question is, well, what is your job there? Is it to run out of the movie theater, or is it to stay in your seat, feel that fear, turn to your friend and say, that was messed up, and then go back to eating your popcorn, right? So actually being willing to feel those experiences. You should be disturbed by your disturbing thoughts. They're disturbing. Great. Be disturbed. Right? It's all the pressure you're putting on yourself to not be disturbed or to end that disturbance that's actually sending the signal to the brain. We need more disturbance. Something is wrong here. There's something that needs to be completed. It's incomplete, and it's exaggerating the effect as opposed to just letting it pass by like it's supposed to.
Yeah, and I think, also, if I'm in the movie and I'm having all this going on, I am willing to not be able to track the movie very well because I've had a lot of intrusive thoughts, and I'm just going to keep moving. I'm going to do the best I can, but I'm willing to pay that price. You just have to pay a price of getting disturbed and not having all your wits about you for whatever your primary task is. Go ahead.
Well, that's where judgment really gets in the way, which is telling themselves, I should be able to focus on the movie. I shouldn't feel these feelings. It comes from a misunderstanding about how thoughts, feelings, and conditioning works. It has nothing to do with you, right? So if you're saying I shouldn't have this thought, or I shouldn't have this feeling, or I shouldn't have this urge, you're implying that you were somehow consulted at some point, and you weren't. That's why self-compassion is really a more rational stance. It's okay that I'm having this feeling. Lots of people feel this way. Yeah, it's difficult. What can I do to help myself through it? That makes much more sense than criticizing yourself for having the experience.
Yeah,
absolutely, John. You took the words out of my mouth. It's a lot of what I think is so helpful when it comes to shame, when it comes to judgment, is learning how to sort of treat ourselves as though we would treat a friend.
Yeah. We're going to go to questions now, but I got one last little pet peeve I'm going to throw out, and you can react if you want, or we'll just let it go. You know, I have people that come in to see me, and they'll go, well, my last therapist said to say to myself, maybe I locked the door, maybe I didn't, I can handle not knowing. And to me, I just think that's wrong, because it's not about the door. And what I don't need to focus on maybe I don't need to focus on being uncertain about whether the door's locked or not. It's not about that. It's about a generic sense of uncertainty that gets provoked from a specific. And so I want people to go up from a specific to a generic. And if you play this out, it's like, okay, maybe I'm a pedophile, maybe I'm not, I can handle uncertainty. To me, that seems nuts. Maybe I just ran somebody over when I drove past them and knocked them into the ditch, and no one knows they're there and they're going to bleed out and be dead by tomorrow morning, and it'll be my fault. Or maybe I didn't. I can handle uncertainty. It just makes the work a lot more difficult when we throw in the context in which that uncertainty shows up, and then we have to be okay with that. So my 2 cents. I'm going to try to work on some of these questions. So at 6:18, Nancy says, some psychologists recommend that you move on and act as though the message is nothing, while others recommend that the client attends to the content and says to themselves, maybe the thought is true.
Yeah, this is what you were just talking about. Right?
Yeah, I guess it was. So that was my answer. You have either of you have anything else you want to say about that?
I really don't want anybody to have a thing that they say in response to a trigger, right? Like that one thing, because then that just becomes the ritual, and that becomes the way they reassure themselves. I said the magic words, and now the trigger's not going to get me. I don't know that I agree that you should never say something like maybe never bring the content in. I think you can bring the content in sometimes. I think some people, especially early in treatment, feel that they need to have a connection to the content that they can then evolve out of over time. I usually say there's 4 ways to respond to a thought, and I don't want you to use the same way all the time. I want you to mix it up and randomize it. You can ignore it. You can be mindful of it, which is to acknowledge that it's there and then let it go. You can agree with the uncertainty of it, which is to say, oh, maybe, I don't know, like you were saying. Or you can agree with it wholeheartedly, with or without humor and sarcasm. Yep, that's right. Didn't lock the door, and I'm going to get burglarized. My life's going to get ruined. Okay, but I got to get to work anyway. And if you're doing one of those things all the time, meaning if you're always ignoring, eventually that's going to become your avoidance. And if you're always agreeing, eventually that's going to become your ritual. You're exposing the thought away. You're not actually dealing with the uncertainty. Mm-hmm. So that's sort of how I approach that idea.
Yeah, and I think what sort of came up for me was similarly in terms of changing the words, but also I do use content in the sense of like, sometimes the language and the words can actually help them connect to the emotional experience. So I'm less likely to sort of give them the script I want them to say, and I want them to use sort of whatever words the OCD is giving them that allows them to connect to what's there. But Reid, in the response that you were giving me, what concerns me about that is, to me, if I'm targeting their core fear around whether or not they're truly capable of handling uncertainty, whether it's the emotions or just simply not knowing, to me, that sounded like reassurance, right? Like, I can handle it. I can do it. Like, I'm a little bit, I'm sort of like, I notice this comes up in sessions with therapists all the time, is us wanting to support our clients and being able to do exposures. But I think the way in which we do it is really important, because we can often give them that reassurance that directly addresses their core fear. Does that make sense?
Yeah, and maybe I misrepresent what I am doing, because the issue, what I'm trying to get them to, is that the disorder is about generic uncertainty that gets applied to a specific. That's really all I'm trying to say is, and I don't, it's not about the door, it's about uncertainty. And I got to figure out how to cope with that. So that's more what I was saying. So at 6:30, Nancy's saying, isn't saying that this is a, quote, OCD thought a ritual because it indicates that the thought is irrational? You know, how I tend to, one of the ways I tend to say it is, I'm going to treat it as an obsession. And this may not be what Nancy's asking about, but it's like in those moments, I don't know whether it's an obsession or it isn't. I'm confused about that, but I know it's my theme, and I know this is what I'm trying to focus on. And if I try to sort out whether it is or it isn't, I'm going to eat myself alive. So I'm going to operate as though this is nothing. This is an obsession. And then I'm going to, you know, whatever consequences I'm going to pay, let's see, let's go.
Yeah, sorry, Jon, to add to what they're saying is I ask them to notice it for themselves, right? So when you say this is an OCD thought, does that actually help you practice having uncertainty in the feelings, or does it take you away from that? Only you really know. I don't know what's going on inside.
I like that. I agree with Nancy for the most part. I mean, I don't use the term OCD thought in my work. I don't believe there is a thing called an OCD thought. There's certainly OCD responses. You know, there's behaviors that can be attributed to having obsessive compulsive disorder. And the disorder might make you more likely to notice certain kinds of thoughts, but those thoughts aren't OCD thoughts. It's your OCD that's noticing them and holding them up in front of you and saying, oh, this is really important. But if you were to write the thought down and look at it, it's, you know, it's like any other thought. It's just, you know, I mean, it could also be nonsense, right? You could look at the thought like, you know, maybe I'm going to wake up tomorrow and be a pedophile or something like that. And you could internally, you can be like, well, that's a stupid thing to think. Like, you could just ignore it, right? You can certainly have an opinion about the meaning of the content of the thought, but the thought itself is not characterized by anything. It's just an ingredient in the stew.
Mm-hmm. Good. So my friend Stephanie's asking at 6:39. That's a question a couple people have asked. How she worded it is, how are you all adjusting exposure work in the world of COVID? Somebody else was saying earlier, you know, I usually get my clients to go out and be out in the world, and now that we've got the stay-at-home restrictions, how do we deal with that? You guys want to try that out?
Well, I'll take a stab at it. It's changed a little bit, right? So we used to put people in situations where they're likely to be triggered. It might be on a public place, a subway station, or, you know, bus stop or something like that. And we used to have them touching things and taking all, you know, being very casual and reckless with washing, and say, oh, yeah, you might get the cold or something like that, and you have to live with that. But, you know, that was all when there wasn't a psychotic maniac of a virus out there trying to kill us all, right? So, all right, so we're not doing those exposures. But that's just one area where the world has changed. Not everything has changed. You know, what's going on inside your house hasn't changed. Your shower or your toilet and your bathroom hasn't changed. I mean, especially if you've been doing social distancing and you haven't been going in and out of the house every day. Very little has changed about what's going on in your home. So I think that, you know, the tendency is to think of COVID as contaminating, for lack of a better word, the whole OCD experience. And now we can't do any exposures. But there's some exposures we can't do, because if you're following the rules of exposure, you never put someone in a situation where you think they're likely to be harmed, or they're, you know, likely to, violate their value, their morals or something like that, their religion. So, yeah, we have to make some modifications. I'm finding that those that are having the hardest time are those who were really finally getting excited about doing exposure therapy. And especially if they had social anxiety and they were getting out there and they were doing things, and now they just can't do those things. And so we're modifying it by creating sort of online versions of those things, you know, and you can do a social exposure of posting on a Facebook page when you wouldn't otherwise do that. It's not as gratifying for me or them to see them do that when they could actually go to that party that they would not have gone to. But, you know, it's something. We do the best we can. And frankly, I've been doing less exposure, not because of the COVID rules, but because everybody, you know, including us, is going through a kind of trauma right now. And sometimes we need to just sit and acknowledge our feelings and just talk about how we're processing this huge change, and maybe take a short break to acknowledge what's going on before we get back into scripting about how you're going to stab your mother in the middle of the night.
Mm-hmm.
Did you want to answer, Marisa, or because I have a question for you after? Do you want to say something about all that?
Nope, no, I'm good.
I just want to return to what you said right at the very beginning around the sadness and depression and loneliness and loss and so forth. And I've not worked with anybody yet who has had that focus. And I know both of you, we talked about both of you have a little bit. My sense is that as this fear side of it starts to diminish, that this is the side that's going to start showing up and may last even longer around loss with deaths, loss of a job, loss of activities, whatever it may be. Do either of you want to speak to that a little bit about what are you seeing in your clients and how's it going around all that?
Yeah, it's definitely showing up. I mean, I mentioned earlier, it's like this overall sense of freedom, just being able to go and do, the social things that we want to do, or perhaps being able to do the work that we want to do, or seeing the people we care about get sick. And some have experienced, death as well. Or we have some folks that are at higher risks. The medical doctors and physicians that are working in hospitals and nurses that are working in hospitals right now. Like there's right now not knowing how this is going to turn out, and all of the uncertainty is definitely threatening, I think, people's sense of security, sense of safety, and their freedom and what matters to them, the people that they love. And so I am noticing this deeper sort of sadness and loss showing up with those folks. And I mean, the way I see it is, exposures are a form of acceptance. And for me, like a lot of what I try and do is focus on being there with whatever shows up, right? So loss, grief, sadness, fear, like that's all a normal and healthy part of this process. And I think if we open up to those feelings of loss, it can also be a really beautiful thing, because it can also really remind us of what matters. And we don't tend to grieve or be anxious about things that we don't deeply care about. And I think if we're willing to go to that painful place, it can also sometimes be a really beautiful learning in terms of what matters.
Yeah, the only thing I could add to that, and I agree with all of that. I find the word grief coming up a lot, at least for me, and the grief is over something changing that will never go back to the way that it was. It might go back to something like the way that it was, or it might go to something even better than the way that it was, but something has changed. And so what comes up for me just personally is, I'm worried that my kids won't remember what it was like to, criticize the quality of somebody's handshake, because we stopped doing that a long time ago when they were kids. It's not easy for me to just let go of those things. Well, this is, the Earth 2.0, and in Earth 2.0, we live with this, virus and everything like that. Right. So the anxiety is coming from I don't care when it ends. I do care when it ends, but I want to know that it will end. Because there's things that have been lost that I'm not ready to give up forever. So,
and it will end, Jon.
Of course,
I mean, it's something we need to keep reminding all of us. We will get to the other side of it. So, I have a question for you, Jon, from David, and he says, "Could you say more about how you suggest using mindfulness as one of the 4 responses to thoughts?"
So I'm just referring there to, as one way to respond to intrusive thoughts, that's a step that engages with it more than simply ignoring it, would be to apply mindfulness. And by that, I mean to take a beat to acknowledge that the thought has arisen and that you are a witness to it and that you are seeing it as an object of attention, and to allow for it to be there, and then to return your attention to what you were doing before you became distracted by that thought. Whereas ignoring would be literally just pretending it wasn't happening. Mindfulness would be taking that extra beat to say, this is happening, and I'm going to let go of my resistance to it happening and return to what I was doing.
Marisa, you're okay around all that? Wasn't to you anyway, so right? Huh?
Yeah.
Nancy's asking at 7:13, would you suggest a client do exposure using quote unquote clean toilet water right now during COVID? I'm not sure what that is. So if either of you know,
Oh, she must be a protege of John Grayson's or something. I would presume that it means touching toilet water that doesn't have any other offending objects in it. You know, that after the toilet has been flushed, and then working with that to do exposure.
is that even possible?
Yeah. Well, the question is that a level of contamination? I think a person could say that's a level of contamination where there's uncertainty. It's not a guarantee that that water is truly dirty, or it might be disgusting conceptually, but there would be an uncertainty there as to how different really is it from the water in the tap if it's doesn't have anything visible in it. And the question is, right now, would I have somebody do that? I think that's not the type of exposure I'm likely to do in general, because it's a little too on the nose for me. I prefer to have them not really know if they touch the toilet water, and I'd be looking for an exposure that put them in that state of not knowing. It can be compulsive to do too much exposure because it's like, yeah, I'm really in it now, and I'm fighting my OCD, and it's not really about real life and living with uncertainty. Mm-hmm. But if I thought that would be an exposure, let's say, dipping your finger in the water and then wiping it on your shirt and then going about your business, if I thought that would be right for that client, the presence of COVID wouldn't change that for me, I don't think.
Yeah, I had a client I was helping get some practices going around cleaning the bathroom. And, one rule she was trying to make for herself is, I'm only going to wipe across surfaces one time, which seemed fine around that. And I suggested another alternative practice might be that she try to rush the cleaning. Because part of her concern is, I don't know, have I splashed something onto the toothbrushes? Did I just get it on myself? What do I need to do? And to the degree that she would be capable of kind of putting her on, if something took me 4 minutes, that I do it within 45 seconds just to see what it would come up, what would come up for me. So that's, I wouldn't, it's my alternative to the clean toilet question.
Right. And sort of piggybacking off of what you're both saying, which is the uncertainty piece, like just labeling it as clean might actually provide a little bit of reassurance and may not target that uncertainty that is really the point of doing exposures.
And we have got a question at 7:22 from Deborah. Would you speak to how difficult it would be to engage in mindfulness when your client is mainly obsessive or has mainly obsessions?
Well, I'm conscious of the time because I think that this is.
You got a lot to say? Is that what you're trying to say?
Well, I think it's part of a much larger discussion. First of all, about the idea that people could have mainly obsessions as opposed to equal parts obsessions.
A pure obsession. Oh, come on, John.
Well, you could obsessively compulse and compulsively obsess. I'll give you that. Okay. So there's a purity to that, but the question is it difficult to practice mindfulness when the engine that does your mental rituals is always in high gear? I certainly would empathize and sympathize with someone who was having that difficulty, but fundamentally it comes down to, okay, can you be a witness to that difficulty? Can you be a witness to that revving of the engine? Because the goal is not to stop your thoughts. It's not to stop your thinking. All it really is to know what you're doing when you're doing it. So if you're thinking and you know that you're thinking, then you can just watch that thinking take place. If there's a reason to stop it, stop it. If there's a reason to continue. Yeah. They say in a lot of meditation circles, sit and know that you're sitting, or breathe and know that you're breathing. That's what it is to be mindful. It's not necessarily to have an impact on what the mind is doing. It's to be a witness to what the mind is doing.
Marisa, any thoughts?
Yeah, no, what I was just thinking about was like how hard it can be sometimes when folks are really stuck either, on the obsession and or on possibly mental compulsions. And I had a client that really struggled with this, who was kind of full steam ahead. I couldn't even break to just kind of notice what was happening. And I wound up just standing up and laying on the floor. And then eventually she stopped. She was like, "What are you doing right now?" And at that point, we were then able to kind of step back and look at, okay, what's been happening these like I tried all sorts of hand signals and nothing. Like what just happened these past 15, 20 minutes here? Like what was that, right? And so sometimes it takes sort of different things to break up that cycle and be able to sort of step back and actually notice what's happening. But I think the more that you practice it, I don't want to say the easier it gets, but the more maybe confident you get in your ability to do it.
Okay, good. And Jon and I were just teasing out here around the term pure obsessional. And the issue is that I don't think we're really finding anybody who is a pure obsessional. It really implies that they have cognitive rituals in some way, as opposed to physical ones. Why in the world we allowed ourselves to adopt a term of pure obsessional when we don't mean that, it always has surprised me. So someone was asking around, can they contact us after this if they have questions? And I was telling Jess that maybe she could throw up the OCD Foundation email and people could directly write to you guys and you guys could write to us. So Jon, Marisa, you want to, almost out of time. Is there anything either of you want to say in closing about all of this? I wonder a little bit, did we accomplish what we were looking for, which was to try to kind of go up one level of abstraction and try to help people understand the common denominator around the specific obsessional subtypes that they have. I don't know if we accomplished that. I guess maybe we'll find out in feedback. But either of you want to say anything in closing tonight?
Just want to say thank you. Thank you, everyone who's watching, and thank you for having me participate. I'm super grateful to be able to do this work.
I feel the same. I don't think I can top that.
Okay, and we know this has been recorded, and so it will get posted on the website of the foundation. I do think that if you signed up tonight, you're going to get an email in the next couple of days once the recording is signed up, because some people did sign up to watch and didn't get to do it. And so they'll be able to find out about it all. Otherwise, thanks everyone for participating. I wish we could have gotten to the 4.2 zillion questions that popped up over the 90 minutes. But have a great rest of your life. See ya.
Thank you.